Come in.
Hi, my name is Khanikee and I'm going to be a student nurse today. Before we get started, can I have your name and date of birth, please?
My name is Khalees Stewart and my date of birth is 7/25/2005.
Okay. I'm going to close the door so you can have some privacy.
Okay.
Okay. The bed is in the lowest position. The call light is within reach of the patient, and there are no cords or anything laying on the floor to obstruct the patient's safety. And today I'm here to perform your health history and a head-to-toe assessment. So before we get started, I just want to ask you a couple questions, okay, about your past medical history. Okay, have you had any injuries or illnesses that you'd like for us to know about?
No.
Any history of like diabetes within your family or hypertension or anything like that?
Yes, my mom's side.
Okay, with hypertension?
With diabetes.
The diabetes? Okay. And would you say you've had any surgeries in the past?
No.
No. And do you smoke or drink?
No.
Or do you partake in like any secular activities like that? Like
No.
okay. Do you have any dietary restrictions? Any cultural or religious things that we should know about while we to help us formulate a plan of care for you?
No.
Okay. So yeah, and what brings you in today?
I'm just here for a checkup.
So for your vital signs, I'm going to start off by assessing your temperature, and I'm going to do that using a temporal thermometer. So I'm going to place it on your forehead. Okay. And your temperature is a 97.5, which is perfectly within the range of 96.8 to 100.4 degrees Fahrenheit, so that is good. And then next, I will be assessing your pulse oximetry. So would you hold your hand out like this for me? Okay. Okay. So your pulse oximetry is a 98%, which is good. It's within the range of 95 to 100. If it was less than 95, then that would indicate chronic lung disorder. And while I was assessing the patient's pulse oximetry, I also assessed her respiratory rate, which is 18 breaths per minute, which is perfectly within the range of 12 to 20 beats per minute. Her respiratory rate, was not deep or shallow. It was normal and equal, and the patient is not gasping for air or has any blockage within the respiratory rate. So the patient is perfectly fine with breathing. And then the next step that we're going to do is I'm going to assess the patient's pulse radially. So I'm going to ask you to hold your hand out. I'm going to use my 2 fingers to palpate the radial artery. Okay, so I found the patient's pulse, and now I will be assessing for use. Okay, so the patient's pulse was 100 beats per minute, which is right on point with the range of 60 to 100 beats per minute. Her pulse was normal, it wasn't bounding or weak, and it was regular. Okay, so now the last step is to observe your blood pressure. So I'm gonna ask you to come over here, move over. Usually when you get your blood pressure taken, is it too high, too low, or normal?
It's low.
It's low?
Yeah.
Usually? Okay. Are you currently taking any medications?
Yes. I'm taking lisinopril, which is a blood pressure medication.
Okay. Keep that in mind. For the doctor. So now I'm going to put in the cuff on your arm. Just let me know if it's too tight or too loose, okay?
Okay.
Is it good?
Yep.
Okay, now I'll be using my fingers to palpate for her brachial artery. your blood pressure was 104/70, which is a bit low, but that could be due to your medication. Because typically the range for blood pressure is 120/80. So while it's not alarming, I'll be putting that into the notes for the doctor. Okay.
Okay.
Okay. Thank you. Now you can return back to the front while I complete your neurological assessment. Okay. So now I'll be moving on with your neurological assessment. Before we get started, I'm going to ask you a couple questions, okay?
Okay.
Okay, have you recently experienced any headaches or any head injuries?
No.
No. Any numbness or tingling?
No.
Any weakness, incoordination?
No.
Have you had any seizures or strokes?
No.
Any difficulty with swallowing or speech?
No.
Okay, so now I'm going to move on with assessing other things like your cognition and your orientation. So, would you mind telling me your name and date of birth again?
My name is Khanikee Stewart. Date of birth 7/25/2005.
Okay, and where are you right now?
At the doctor's.
Okay, and could you tell me the month and the year, please?
Yes, it is November of 2025.
Okay, so the patient is awake, alert, and oriented ×4. While I'm talking to the patient, their speech is clear and logical. They respond to my questions appropriately. The patient also does not need any additional stimuli to respond. The patient's eyes open spontaneously and they are aware of their surroundings. So now would you mind looking at my nose? Okay. The patient's facial features are symmetrical at rest. The patient's eyes are symmetrical at rest also. They look clear, round, and now we'll be moving on to my pupillary assessment. So before we move on to that, would you mind covering one eye? Covering your eye, yep. And tell me what that word says at the top.
Clock.
Okay, you can put your eye down. And then now I'm going to darken the room and assess how your pupil reacts to light, okay?
Okay.
Wait. Okay. Okay, so I want you to continue looking at my nose, okay?
Okay.
Okay. Pupils, and now I'm going to turn the light back on. Pupils briskly responded to light and were accommodative and relaxed. Okay, so now I'm going to ask you to stare at the door and then follow my finger coming in. Okay, the patient's eyes were accommodative. They did constrict and converge while I did my finger movements. So now I'm going to have to ask you to look at my nose again and follow my fingers just with your eyes, okay? Okay, the patient's eyes had smooth movement and everything. Her pupils were clear, equal, round, reactive to light, and accommodative. And there's no eye edema or any issues with her eyes. Okay. So I'm going to put my fingers out and I want you to grasp them as hard as you can, okay? Not down, just grasp them, okay? And then I'm going to pull and I want you to resist me, okay? Okay, and then I'm going to push and I want you to resist me, okay? Okay, the patient's hand grasps were strong and equal bilaterally. Now I'm going to ask you to point your toes down like you're pointing on gas. Okay, and then up towards your nose or towards the ceiling. Okay, and the patient's movements were symmetrical and equal bilaterally, and their flexion was perfectly within range. So now I'm gonna ask the patient to do those movements again against resistance. So I want you to put your foot out. Okay, and then plant your flexion, like point like you're pointing towards gas against resistance. Okay, and then point like you're pointing up against resistance. Okay, so the patient's movements were strong and equal bilaterally. Now I'm going to assess for your sensation on both your upper and your lower extremities, okay? So I'm going to ask you to close your eyes. Put your arms out. Do you feel that?
Yes.
Okay. Do you feel that?
Yes.
Again, I'm going to tap and I want you to tell me where am I pressing, okay?
Okay.
This
My
is your
forearm.
Okay, is your right or left forearm?
My right.
And then,
My left forearm.
okay, and then,
My right knee. My left knee.
Okay. Patient has sensations bilaterally on both the upper and lower extremities, and they are both within range. And now I will be further assessing the patient's sensation using an object. So would you mind closing your eyes? And then tell me if the pain you feel is sharp or dull, okay?
Okay. Sharp. Dull.
Okay.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Patient continues to show that sensations are equal bilaterally, both upper and lower extremities. And now I'll be moving on to assessing the patient's cranial nerves. Yeah. Then I'll be assessing the patient's first cranial nerve, which is their olfactory nerve. So would you mind closing your eyes, please? And would you mind telling me what you smell and if it's distinct? Okay.
Alcohol.
Okay. So the patient's first cranial nerve is intact. Okay. And I assess the patient's second, third, fourth, and sixth cranial nerves doing my pupillary and eye assessment with my fingers and their reactivity to light and with the patient's eye movements. Now I'll be assessing the patient's fifth cranial nerve, which is their trigeminal nerve. So would you mind clenching your jaw for me, please? Clenching your jaw. Okay? The patient's fifth cranial nerve is intact as the patient's jaw was clenched and you felt the sensation, correct?
Mm-hmm.
Now we'll be assessing the patient's seventh cranial nerve, which is their facial cranial nerve. I'm going to ask you to do a bit of funny facial movements, which is go along with me, okay? So would you mind puffing out your cheeks? Okay, relax. Would you mind smiling with teeth? Okay, raising your eyebrows. Okay, I will be touching the patient's cheeks and down here. Is that okay with you?
Yep.
Okay. Okay, tell me if you feel that. Yep. Okay, so the patient's seventh cranial nerve, which is a facial nerve, is intact and functioning. Okay, now I'll be assessing the patient's eighth cranial nerve, which is the vestibulocochlear nerve. Do you mind standing for me, please? Okay, and close your eyes, and I'm gonna snap and tell me which ear you hear it in, okay?
Mm-hmm. Left. Right.
Okay, you can open your eyes. Now I'll be assessing the patient for 15 seconds to see how balanced the patient is. Okay, the patient's balance and hearing is intact. The patient is not tipping over. They can support themselves. And the patient also heard what ear, the patient also appropriately responded to what ear they heard the snaps in. So the eighth cranial nerve, which is the vestibulocochlear nerve, is intact and functioning. So you can take a seat again. And now we'll be assessing the patient's ninth cranial nerve, which is the glossopharyngeal nerve, by asking the patient a question. So do you have any difficulty swallowing?
No.
Okay, so the patient's ninth glossopharyngeal cranial nerve is intact. And now I'll be assessing the patient's 10th cranial nerve, which is their vagus nerve. So I'm going to ask you to open your mouth and say ah, ah. Quietly, or lift your head up. Yep, the patient's uvula is midline and intact, and the patient's sounds were the patient verbalized audibly and clearly, and I could hear. So the patient's 10th cranial nerve, which is the vagus nerve, is intact. And now I'll be assessing the 11th and 12th cranial nerves, which are the accessory and the hypoglossal nerve. So I'm going to ask you to shrug your shoulders against resistance for me. Shrug. Okay. The patient's accessory nerve, which is the 11th cranial nerve, is functioning and intact. And then I'm going to ask you to stick your tongue out and then just do a couple tongue movements for me. Okay. Up, down, around. Okay, the patient's 12th cranial nerve, which is the hypoglossal nerve, is functioning and intact. Now we'll be assessing the patient's reflexes with a reflex hammer, starting with their knee or patellar reflexes. Okay? Okay, the patient's reflexes were equal and symmetrical and bilateral on both sides. The patient reacted to the reflex hammer. So now I will be assessing the patient's bicep reflex by asking them to bend their arm at a 90-degree angle, and then I will be tapping into the crease of their arm. Okay? And then this side. Okay. The patient was not reactive to the reflex hammer, but you felt sensation on both sides, correct?
Yes.
Okay. And now I'll ask the patient to hold the arm up like this. Okay, I'll tap your elbow. So that one. And the same with the other arm. Okay. The patient reacted to the elbow reflex, yes. And it was equal and symmetrical and bilateral on both sides. Now my last one will be to assess their ankle reflex. So I'm gonna have to ask you to take your shoes off really quick. Okay, and then scooch back a bit for me. And then hit just above their heel. Okay. Okay. So the patient was reactive to the ankle reflex, and it was equal, symmetrical, and bilateral on both sides. And you felt all sensations while we were doing this, right?
Yes.
Patient felt all sensations. Okay. So I just finished assessing the patient's vital signs, getting their health history, and also did their neurological assessment. My next move will be to assess their head, their eyes, their ears, their nose, and their throat, and their musculoskeletal assessment. So my first step is to observe and inspect the client's head and upper facial side. So in my previous assessment, I noticed that the patient's facial features were all symmetrical. There was no drooping anywhere or any lagging. So now I'll be assessing by, would you mind if I touch your sides of your head?
It's fine.
Okay. And then okay. The patient has no lesions or growths or any rashes or any skin conditions. The patient's skin is dry and intact. There are no abnormal hair patterns. There are no abnormalities present during my inspection. And then I will be inspecting their upper and lower extremities as well. So just put here like this. Okay. The patient's upper and lower extremities look symmetrical and bilaterally. There is no swelling anywhere, neither is there in the facial or head area. There is no swelling or edema. The patient looks fine and intact. Okay, the patient's head is symmetrical, and when I look, the patient's nose is midline, their sclera is clear, there is no edema on the eyes, there is no redness on the eyes, there are no abnormalities present in the head region, nor in the upper extremities or in the lower extremities. Now I'll be observing and assessing the patient's neck. So at the moment, the patient does not have any lumps or growths or lesions on their throat, and I'll be palpating for their lymph nodes. Is that okay? Okay. There are no swollen lymph nodes present, so that means the patient doesn't have any respiratory infection at the moment. Then I'll be palpating the patient's thyroid. Okay. And would you mind swallowing for me, please? Okay. So I felt a sensation when the patient swallowed, and now I'll be osculating for their thyroid. Checking to make sure my stethoscope is on. Okay, there are currently no abnormalities with the patient's neck. Their trachea is midline. Their neck is symmetrical. There are no bumps or lesions or anything like that present at the moment. Okay, and now I'm gonna shine a pen and ask you to open. I'm gonna ask you to open your mouth. Okay. Okay. The patient's mucosal membrane is intact. There is no redness or any rash or any abnormalities in the patient's throat. The uvula is also midline. Their trachea is midline. Everything is symmetrical and intact. So now I'll be assessing the patient's range of motion in both their upper and lower extremities. But before I start that, would you mind lifting your head, bringing it down, moving in a circle? Okay, the patient's cervical range of motion is a 5, and now I'm going to be assessing their elbow range of motion by flexion, okay, extension, other arm, flexion, extension. Perfect. And then I'm going to ask you to bring your arms up and over your head. And then down, crossing the midline. Okay, and then for your legs, we're going to do a put it away from you. Okay, bring it back in. Away from you, bring it back in. Okay, rotation of the rotation of the leg. Okay. So the patient presents a 5 out of 5 range of motion. If the patient had passive range of motion, meaning they couldn't move their limbs by themselves, I would be assisting with that. But since the patient does not have that, the patient receives a 5 on their range of motion. For both upper and lower extremities, it was symmetrical, bilateral, and equal on both sides. So you can sit back down. So I just finished assessing the patient's range of motion. All of the motion was smooth, and now I'll be palpating and then assessing their resistance. So first I'll be palpating their face. Would you mind? Is it okay if I touch your face? Okay, did you feel that? Okay, now palpate your sinuses. Did you feel that? Okay, and then I'll be palpating your arms. Okay, the patient has no swelling or deformities or edema in neither their upper or lower extremities. Everything is bilateral and symmetrical. The patient seems fine. And now I'll be assessing their range of motion against resistance. So would you mind holding your hands like this, like you're holding a pizza box? Okay, and then I'm gonna press down and you resist me, okay? Okay, and would you mind turning your palms downward like this? And then I'm gonna press up and then you should resist me, okay? Okay, and now put your feet up. And I'm gonna press down and then you should resist me, okay? Okay, and I'm gonna press up and you should resist me. Okay, the patient presents a 5 out of 5 both with range of motion and against resistance. So a +5 full range of motion against gravity with resistance, with full resistance. For my last palpation or inspection, I will be assessing the patient's warmth on both upper and lower extremities. Like this. Patient is warm, and did you feel those sensations?
Yes.
So the patient, there's no excessive heat or swelling or anything going on with the patient. The patient is fine and everything is intact. And now I'm going to ask you to lay down flat on the bed. Okay, and then I'm going to ask you to raise your leg, one of your legs, while I resist. Okay, and then the other one. Okay. And today that completes my assessment. Thank you, Khalees, for cooperating with me today, and I will be taking all of these notes before the doctor sees you, okay? Thank you. Have a good day.